Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and Lene.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
Hey, Tripp, what's up, man? How's it going?
So I got a joke.
Tell me a joke.
What's a robot's favorite snack?
What is a robot's favorite snack? Nuts and bolts?
No.
What?
Computer chips.
Computer chips. That's so funny. You know you're a dad when.
Mm-hmm.
Oh, so hilarious. You know, I bet robots have problems conceiving.
Oh, I bet.
Which kind of segues bluntly into what we're going to talk about today, which is infertility. And I think overcoming fertility has been a kind of an unexpected success that we've experienced at Infinite Health. I don't think we never set out to help anybody conceive, but it just kind of became a happy accident at first. And then a byproduct of helping people optimize their health naturally.
Interesting.
And so I thought maybe you could talk about that today, because I think I read somewhere, and listener, you can correct me if I'm wrong, but I think I read somewhere that 1 in 5 women over 35 or something have difficulty conceiving. I may be making that completely up,
Sure.
But it does seem to be, particularly in our area, an increasing problem that women are having, and not even just for women over 35, which is the high risk population, but even younger ladies are having difficulty conceiving as well. I think you had a patient who was she under 35? She was a bodybuilder, like a competitive bodybuilder.
I had a few. One was a massage therapist. I think the first patient that I ever tried to optimize that was having fertility problems.
But she didn't. Did she come to you specifically?
She was. You remember, she was renting some space out of our office there.
It was so long ago.
Yeah, it was quite a while ago. And while I was in clinic and she was there, she was seeing some patients.
Oh, right. And she was young.
Yeah, she was young. I think she was not 35. She was.
Wow, I don't even know. She was 30.
Around 30, but certainly not. And she came to me. She asked me. She said, "Well, does this optimization stuff you do, will that have any impact on getting pregnant?" So I kind of asked her what was going on, and she had been through. I mean, it had been 2 or 3 years that the couple had been to conceive and unprotected sex and all that, and they had gone through all of the stuff. I mean, she'd gone through in vitro fertilization.
She dropped some money down.
Yeah, so she had spent time, money, and effort to try and have a child, and so I got her history and everything. I said, well, theoretically, in my mind, I was thinking about the things that I look at in laboratories and things like that, hormone levels and all these other things. And I said, well, yeah, theoretically, any of these parameters could potentially preclude you from being able to get pregnant. And, of course, I talked to her about her spouse and that testing. But what transpired is that I got labs on her and I found that she was not hypothyroid. Minor hormones were off, but I found that she was what I call suboptimal thyroid. And basically, so I corrected all the things that we found, and she was feeling much better, actually. Energetically, she was feeling better in that. And things went on, and about, I forget if it was 2 or 3 months later, she came into the office with an ultrasound photos of twins.
Oh, you were twice
Yeah.
as good as you meant to be.
Yeah, I guess.
Well, and just for clarification, there's a particular definition for someone who is infertile, right?
Well,
It's if you've been
typically unprotected sex for 1 year.
for 1 year.
Yeah.
Okay. Wow. And so after
She was way beyond that.
she had been unsuccessful in conceiving for more than a year, you got her on optimizing her health, and within 2 months,
3 months,
2 to 3 months, she got twins.
Yeah.
Wow.
So she tells a friend of hers. She tells a friend of her having the same problem. Well over a year, spent all the money, done all the stuff. Got her in, did the panel, found a bunch of few things suboptimal, and
a bunch of few
things and corrected those. And obviously, as we're doing this, I'm doing the same thing with doing the mind body course and everything like that, because many times couples, they become so focused on procreation that it becomes
stressful,
very stressful, and so it's kind of a resistance that comes up. So they're fighting.
So you kind of got to get it into this mindset where you want a baby, but you're not attached. You got to detach from the outcome, right? That's tricky.
It's hard to go in the flow sometimes.
Yeah. So do you find that that mindset can actually
I think
inhibit
all the patients I've been successful with? I mean, that has been a very strong component, I think, because they become almost obsessed, and being able to allow that, based on whatever beliefs you have, allow that it's going to happen when it's going to happen, and that's a let go. Know that you want it, but just let go. And there are exercises and stuff we do, but at the same time, so the second woman comes in, same almost exact story. And 2 or 3 months after, I get her optimized. Oops, there we go. She's pregnant and moving on. And, I think the parameters, some of the parameters that are being used to conventionally define endocrine, either good or bad, are probably some of the reasons why some women are not successful, because they're, our parameters, the laboratory parameters, for example, for thyroid, the laboratory parameters for thyroid are based off of, a population where we don't know the people who had the normal parameters were healthy or not at the time they had their bloods drawn. And then on top of that, each person is different. Each person at a given moment of time has a different requirement. So those personal requirements for well-being and optimum body function then are not being, if you're in a normal range, they're not being optimized for the individual. And so
because in the traditional setting with wherever they're going, they're looking at the bell curve of where everybody in theory should be.
If everybody's falling into the bell curve, with 1 or 2 standard deviations from the norm, then they're termed normal. So within those parameters for thyroid, if you allow that the upper limit of normal is 4.5 nanogram per deciliter for the thyroid.
I have no idea what that means, but okay.
It's the concentration of a thyroid hormone in the blood. Then you basically exclude that population and say maybe good for is really only functioning well when their thyroid stimulating hormone is, say, at 0.5. And so that can cause a relative hypothyroidism, so to speak, for that individual in that moment of time.
Excuse me.
So that being said, and getting things back into kind of an optimal flow for that individual, then creates a less inflammatory environment. And that's another thing that, and you mentioned this, I think, in another one of our podcasts. I mean, the environment we live in is fraught with, a carb-loaded diet with, that we know creates a lot of inflammation, and, the obesity and
Pasta isn't going to get you pregnant.
Yeah, pasta is not going to get you pregnant.
Well, and I was also conceptualizing, we live in this, was it carcinogenic alley, or what do they call it? Because of all the refineries and
right.
Cancer alley, right?
Mm-hmm.
We're in, I don't know if that stuff in the air might be a contributing factor as well.
Well, certainly could, but I think the real challenge is, are we screening and doing the best we can for each individual as opposed to the population? And, I see the results that we've had with doing personalized optimization for women. And the resulting pregnancies, even in the face of being defined as infertile. And it's not only the women. I mean, I've had two men that were spouses of the wives, and the wives looked like everything was good, and so optimized the men, and oops, they get pregnant. So,
do you find that men are reluctant to think of themselves as the reason they're being unsuccessful? Do you find the male ego being a barrier to overcoming some of those issues?
I think it depends on what the goal is. I mean, yeah, that's more a social phenomenon, I think, than an individual. I think that's a social conception, not a.
But it's generally the women that are calling, right? When's the last time you had a guy call you up and be like, "Hey, I'm having trouble getting my mate prego"?
Right. I guess that is unusual, but women in healthcare, you're the one that says it all the time.
70% of women make healthcare decisions for the family.
For the family.
Yeah.
And so.
Yeah. I know for a while there, you had so many women the program was so successful that we were on vacation and the office called, and it seemed like somebody was calling to say you got them pregnant again.
The one. Oh yeah,
I'm like,
right.
Wait a minute.
Oh, that's right.
Hold up.
I think I think it was the third or fourth young lady that had come kind of by the word of mouth from the massage therapist on down, and her friends. And I think she was in her 20s. And I didn't even see this happen. You told me later, but I think on a Facebook post, she comes up to you and said, "Oh, Miss Goolsby, I can't tell you how happy I am that your husband got me pregnant."
Yeah. Awkward conversations. Awkward. Yeah. So when somebody's going to where do they go? They go to their OB-GYN and generally initially.
It's OB-GYN.
What are there particular questions that they should ask to be looked at that maybe aren't being evaluated?
Well, I think the standard evaluation for infertility it covers all the same parameters that I cover. I mean, for the hormones, prolactin levels, the cycling, and the ovulation testing for ovulation, and that in more mature women. But I think it's how it's addressed as within the limits of normal, and maybe clinically how I'm looking at the optimization process and then the mind body component, because as you mentioned in the very beginning, I think one of my patients was a female bodybuilder and quite intent on doing that. I think she's also a physical therapist, and the challenge there was at the very beginning. I got her optimized and everything looked really good. Nothing was happening, and we were a few months down the road, and I noticed that she was still participating in this aggressive exercise.
She had a competing vision for what she wanted.
Very competitive, focused on that outcome.
Right, but being pregnant doesn't really lend itself well to the body image you need to have to win a competition in a bodybuilding setting, right? I mean, how many pregnant bodybuilding competition winners have you seen? So it seemed like she had two competing goals. On one hand, she wanted to win the bodybuilding competitions, but on the other hand, she wanted to be pregnant. and have a baby, but those two don't necessarily
Match.
jive.
Yeah. What happened in her case is that in the beginning, she also wasn't compliant with doing the homework, the reading the chapters and us discussing and getting a different mindset. And it came to the point where I had to pointedly say, this is a component you're not participating in, and I believe it's the one that's causing you not to
succeed.
And so she thought about it and started participating
in the mind-body
component. And then ultimately she actually started getting into it. And her thought processes then became more congruent with her outcome, her desired outcome. And it's well known with female athletes. I mean, competitive female athletes, they shut down. They don't have menstrual cycles anymore. I mean, they're not ovulating. All of that is, they're very, women are very sensitive to that. Men too, but spermatogenesis is maybe not quite as affected by stress as the female ovulatory cycle. So being mindful of that and knowing that may be impacting the hormone balance that is required to have pregnancy is really, really very important. So a couple of months after she started getting into the book, she actually got pregnant for the first time. And I think they were the ones that called while I was on vacation for the second one too.
Right. I think people underrate mindset work,
Mm-hmm.
I think a lot of people just kind of blow it off because it's not tangible. It's a little more subjective and etheric, or they think that they already know it. And so they kind of blow it off. But
and they think they're relaxed. I can't tell you how many people that I don't feel stressed at all, and then I'll do the heart math testing on them, and they'll be pegged in the red. And
real quick, what's the heart math test?
Oh, it's a heart rate variability analysis that has been correlated with stress and relaxation.
It's somebody's ability you can measure somebody's stress. Okay.
Yeah.
Might have to go into that deeper. Is that like coherence?
Mm-hmm.
And so somebody's coherence would have an impact on their ability to get.
That drives relaxation and de-stress. Yeah.
No, we'll have to delve into that at a later date.
Mm-hmm.
Cool. Yeah. So, okay. Well, I think that answered most of my questions.
Really? Well, that's good because we're at 20 minutes.
Out of time. All right, listener, I hope you found this helpful. And until next time, feel it, look it, live it.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm Lene. Until next time, feel it, look it, and live it.